Miss Minson. I'm Melissa, and I'm going to be your OT today. Is it okay that I call you Miss Minson?
Yeah.
Okay. Nice to meet you. Today I'm going to be performing a range of motion test as well as manual muscle testing on your shoulder. This is going to measure your abduction and your adduction. These tests will help us to determine where you stand compared to the normal ranges as well as detect any abnormalities. Is it okay that I perform these tests on you today?
Yeah.
All right. So first let me wipe down the table so we have a clean environment. So first I'll have you sit down with your arms down by your sides. I'm going to measure the abduction range of motion of your shoulder joint. Please, if you could, raise your arm to the side and upward. Good. Now I will measure that motion by placing the center of my goniometer at the midpoint of the posterior aspect of your glenohumeral joint. This is about 1.3 centimeters inferior and lateral to your coracoid process. The stationary arm will be parallel to your sternum. So now I want you to raise your arm again while I stabilize your clavicle and your scapula. By me holding onto your clavicle and your scapula, I will limit your range of motion to just glenohumeral movement. So if you can raise your arm again. All right, stop. All right, I will now measure that with the goniometer to determine your range of motion. So it looks like you're around 115 degrees, which is within the normal range of 90 to 120 degrees. The action of adduction would be reversing the motion and bringing it back down to your arm to 0. There's not really a way to measure this. Next, I'm going to measure abduction of your muscle strength of the middle deltoid, which originates at the acromion process and the spine of your scapula and inserts on your deltoid tuberosity of your humerus. And your supraspinatus, which originates at the supraspinous fossa of your scapula and it inserts on the greater tubercle of your humerus. Since you were able to abduct your arm before, I know that you're at least a grade of a 3 and you can withstand gravity. Now raise your arm to your side at a 90-degree angle. Okay, and now I'm going to place one hand just above your elbow and the other hand on your shoulder. Now, as I push down on your arm, I want you to resist my force. 1, 2, 3. Good, you held, so this means you're a grade of 5. While you're in the same position, you raise your arm, I will test adduction. The muscles for this are the pectoralis major, which originates at the middle half of your clavicle and sternum, upper costal cartilages, and the aponeurosis of your upper obliques, and it inserts on the biceps groove and the greater tubercle of your humerus. The latissimus dorsi, which originates at the spinous processes of T7 through L5, the iliac crest, the thoracolumbar fascia, the inferior angle of the scapula, and the lower 4 ribs. It also inserts on the biceps groove and the teres major, which originates at the lower lateral border and inferior angle of your scapula. It inserts at the biceps groove of your humerus as well. Now, while I push up proximal to your elbow, I want you to resist my force. 1, 2, 3. Good, you held, so you're still in the normal range or in the range of 5. If you're not able to withstand gravity, I would have you lay on your back on the table with your arm out to your side while I perform the same test. This would be the gravity reduced plane. So it was great working with you today. So it was awesome meeting you, and have a great day.
Thanks.
Thanks.